Jen here. I'd like to chat to you today about acupressure that you may find useful if you're feeling overwhelmed with stress or anxiety. They can be really calming points that we can obviously use in acupuncture as well. But acupressure is useful because you can practice yourself or perhaps ask somebody to help you with that at home. And of course it may be an adjunct along with some of your other strategies for managing stress and anxiety and tension and possibly even worries. So I'd like to walk you through the points that we have that we can use for these reasons, and hopefully you'll get a greater sense of where they are, and you won't need this video eventually to just nip to those points and reference them, and you might find some more useful than others. But with each of these points, you might like to start firstly in a more relaxed position. So that may be laid on the floor or on your bed or reclined on your sofa, somewhere that is a position of comfort. And ideally one where you're not bolt upright like I am now, for the purposes of showing you these points, because that can sometimes lead you to be a little bit more challenged with releasing tension in the tissues as well. So I'd like you to start with the top of your head, and if you can try and visualise that from the top of your ears you're drawing a line straight up, trying to get the fingertips to meet at the top, and then just using one of your hands and a couple of fingers to identify a little groove right on the top of your head. It may be a little bit sensitive, but you shouldn't be pressing so hard that it really hurts. And I'd like you just to apply some pressure there, and if you'd like to close your eyes as you maintain a pressure as tolerated, and just focus on some breath cycles. So a breath cycle is a breath in followed by a breath out, and it's not a case of over breathing and making a bigger breath than you'd normally make, but just observing that ebb and flow of your breath. So there's a point that you might like to start with, and then the next points you have at the top of the shoulders that I'd like to share with you. So if you try and visualise that the neck is a more vertical structure, whereas the shoulder is a little bit more horizontal. So take the point where they meet, and then think about where the end of your shoulder is, and go halfway along that line, and then pinch the top of your shoulder. Now, as I mentioned before, it's quite hard to reach the right point without being in a more relaxed position. But if you lift your shoulder up slightly and you pinch with your pincer grip, you should be able to find a point that does generally feel a little bit sensitive. And you can apply some tolerable pressure there, and again maintain that for a couple of breath cycles, and doing that on each side. Now there are other reasons why that may be tender and sensitive, but for the purposes of this tutorial, let's just stick to acupressure. And then I'd like you to move towards your sternum. So get a sense of where your collarbone is, the horizontal bone that you can feel that runs at the front of your shoulder and chest area, and then move into the groove below that. So you can feel that you just drop off the bone. You can do that on one side at a time, but obviously you would try this on each side if you wished. And then draw it down a little bit, and you can feel a knobbly rib, and then move centrally to your chest. And then apply a little bit of pressure centrally to your chest there, and it might feel again good to be closing your eyes and just tuning in to the breathing in your chest. Now, I wouldn't advise that you do these if you're pregnant without checking with a suitably equipped professional first. And then moving from there to your hand. So on your hand, on the side where your little finger is, right at the base of your hand, where you feel your wrist start, there is a knobbly bone that feels a bit like a P. That's called your pisiform. And I'd like you to drop your finger off that bone, slightly behind it, and you can feel a little groove there. So apply a little bit of pressure at that point, and again, just breathe. So holding, sustaining and breathing. And of course you can do this on each side. So you can revisit and rewind and pause this tutorial as much as you need. But that can be a really accessible area wherever you are, and nobody will notice that. They may observe you putting your hand on the top of your head a bit more. So how does it feel? And then we're going to work our way down a little bit further, and this time we're going as far as to our ankle bone. So again, we would do this for each side of the body, but I'd like you to find the knobbly bone on the inner aspect of your ankle, and then apply 4 fingers from the highest point of that knobbly bone, and then use the other hand to come in on that point at the top of those 4 fingers and slightly behind that big bone that you can feel, that's the tibia. And apply some pressure there, and again, just maintain it, perhaps for 2 or 3 breath cycles. It can be sensitive. You could do this on each side simultaneously if you wanted to. And then finally, the point I'd like to share with you next is actually on your foot. So I'm not sure how well you'll see, given how far I am from the camera here, but if you go between your big toe and the toe next to it, your second toe, and look at where the web is, so at the point where the toes feel to finish and the foot starts to continue up towards the ankle. And then about an inch from there, you want to apply some pressure between the big toe and the second toe. And again, that's as tolerated. You might like to maintain that for a couple of breath cycles as well, and do that for each side. So it wouldn't matter which end of the body you worked from, perhaps head to toe or toe to head, but it might feel more useful if you do have a sequence so that you don't miss these points out. And then as you get more familiar with them, you may just tune into some more than others, because it's easier to get to some than others. But do try and take a little bit of time for yourself and see how you feel afterwards. And if your level of anxiety or stress, worry, that feeling of being overwhelmed has in any way changed. And of course, that's the best way to know if it's being effective. And if it is, keep doing it. And if you'd like to explore that further, then of course, acupuncture might be something that could assist in that way as well. So I hope that's been useful. And until next time, thanks for tuning in.